Welcome to the RN Mentor Podcast. I'm Dr. Ali Tayyib, nurse, educator, advocate, and United States Navy veteran. This show is about real conversations with nurses moving the profession forward. We discuss leadership, practice, policy, research, and more. What matters and why it matters. I'm glad you're here, so let's get started. Welcome to another episode of the RN Mentor Podcast. I am delighted to be joined today by Dr. Marshall Blue Sr. Dr. Blue is the Director of Pediatrics at St. Joseph Medical Center, a Dignity Health CommonSpirit organization in Stockton, California. Dr. Blue brings extensive leadership experience in healthcare systems where he has successfully led teams, developed innovative programs, and championed initiatives aimed to improve health outcomes and advancing health equity. His work spans both inpatient and outpatient setting with a strong emphasis on patient care, interdisciplinary collaboration, and healthcare operations. Dr. Blue is a graduate of the University of San Francisco with a DNP in Healthcare System Leadership. He holds an academic certification as a clinical nurse leader, a clinical certification as a neonatal ICU nurse, as well as public health nurse certification from the state of California. He is licensed to practice nursing in the state of California, Connecticut, and New York. Throughout his career, he has played an active role in numerous civic and charitable organizations that provide social services, education, and healthcare in the local community. Currently, Dr. Blue is the past president of the local chapter of the Association of California Nurse Leaders and also serves as a state board representative from the California North Central region. In addition, he is a national board of directors member for DNPs of color, and serves as the interim vice chair of that organization. Welcome to the show, Dr. Blue.
Thank you for that introduction.
Yeah, so just for my guest, the bio is much longer and it'll be on the website for you to check out. But I wanted to make sure I have plenty of time to speak with you and be cognizant of your time because we've talked before and I feel like we can talk for hours.
Yeah.
So not because of me, but you have so much great content that you share, and I always love our conversations. So welcome to the show. And let's get started. First question for you. How did you start in the world of nursing?
Wow. That takes me back to actually high school. I really had one of my favorite instructors, and I would say she was my school nurse, but I called her my instructor because she was someone that I could sit with, and she would actually assist me with algebra. Uh,
Oh,
And the reason why I kind of connected with her um, is because she had some great stories of what she did as a registered nurse during World War II.
oh wow.
And so I would sit with her really throughout the class period for algebra because I didn't really enjoy algebra in the regular class. So I would always say, hey, I'm not feeling well. And then they would send me to the school nurse, and she would sit with me and go through my studies with algebra. And then while she's doing that, really was engaging and got me interested in nursing. And
Oh.
from then, then on, I knew nursing was my path. And really, the last 3 years of high school, I did well in algebra. I took LE2, trigonometry, physics, and I think she was that foundation for me to really continue in the sciences and really wanting to become a registered nurse. So I applied to nursing school in college my senior year and was accepted into 3 different colleges. And I chose Loma Linda University for my undergrad.
Oh, amazing. You lost me when you said your school nurse was teaching you algebra because if we're going to be stereotypical, nurses are not great with math. So my palms get sweaty when you mention algebra. So
Yes, yes.
so that's fantastic. So what was your experience going through nursing school at the time?
Uh, that was um, something I look back on as the beginning of understanding the inequities that
Mhm.
are present for people of color like myself
Wow.
to attend or go through university. Um, Loma Linda is a primarily white institution, Christian institution, and one of the top performing medical schools, dental schools in really in the country. And I chose to go there because it is really part of my faith as a Seventh-day Adventist. So I chose Loma Linda because it was a university that I really had ties to. However, uh, I still experienced those um, feelings of sometimes inadequacy, feeling like I was alone, not able to connect with all of my instructors, and really what kind of got me through was, I had family that had attended the school prior to myself, who were able to help me navigate. Um, Also, I did connect with some of the leadership. One of the vice presidents uh, really became great friends with myself, as he was great friends with some of my older brothers who had attended. And he kind of took me under his wing and kind of helped me
Nice.
navigate some of the uh, circumstances that may or that arose because I felt that I was being like mistreated or
Mm.
not fairly treated when it came to uh, some of my clinical rotations, things like in trying to navigate nursing school. Um, so that was it was a little difficult for me. However, I got through, and I was initially enrolled in what the BSN program. However, due to just feeling like this was not the school for me, even though it should have been, I
Right.
opted for the ASN program. And halfway through my BSN, I said, okay, I'm ready to move forward with my life. This is not
Mm.
something that I feel that is going to really help me in terms of completing my education with my BSN, just because I didn't feel that Loma Linda was the best place for me at the time.
Yeah.
Looking back, that may not have been the best decision, but it worked for me then.
Yeah.
I was 20 years old when I completed, sat for my NCLEX at the time, and received my RN and started working as a nurse. So I can't say I looked back on that part of nursing school as something that was exciting and wonderful. However, it did give me a great foundation to build upon.
Yeah.
I was never denied employment because all I had to say, I was a graduate of Loma Linda University. Oh, yes, we want you.
Nice.
So
Nice.
it came with its great points as a foundation for my career. Uh, However, navigating those first 2 years, you know, I didn't look upon that time as something that I would want anybody to really experience. So
Yeah. Well,
difficult.
and as you mentioned that, it's unfortunate because we still continue to see some of that in various schools,
Yeah.
because our faculty continue to be primarily white, and unable to incorporate that sort of that cultural sensitivity into their own teaching methodologies. So it is unfortunate that you experienced that then, and it's still unfortunate, I want to say, that we still are dealing with a lot of that because I hear it from students all the time that and even, and it's not just a matter of different ethnicities, but even men in nursing face that.
Oh,
I knew somebody who luckily I didn't have as a faculty member, but I knew somebody who was a faculty member at a university and adamant about the fact that men did not belong in nursing. And I'm like, I would hate to be the student in any cohort that she had, just because of that mentality. If you don't feel somebody belongs, you're going to act accordingly. And it's unfortunate that we still in this highly ethical and trusted profession that's what we continue to deal with. Um,
I would agree.
so you got a job, you moved on, and based on your current position and some of your certifications, you definitely went a very specific route. Did you start out in the peds world, or did you slowly migrate there?
Um, the first year out of school, I took a position as um, neuro, uh, fairly high acute neuro orthopedic unit at Loma Linda University Medical Center, and quickly realized that was not the place for me. So after spending about a year as an adult med surg telemetry neuro orthopedic nurse, um, I was able to transition to the neonatal unit by way of floating to that unit and taking care of what we consider the lowest acute grower feeder, where you sit down and you feed infants and change their diapers, and they're usually fairly ready to transition home.
Yeah.
So again, their acuity is low, and somebody like a novice like me can generally handle feeding and changing diapers. And having some experience with my nephews and nieces, you know, coming along when I was in high school, changing diapers and feeding wasn't something that was not part of my repertoire
Yeah.
of things that I could do as a young person. So I enjoyed that. And while I was there, during a break, I would wander and find myself into the areas of the higher acute ICU infants, and
Yeah.
to see these really tiny babies being kept alive with these ventilators and all these tubes and wires everywhere. And I said, this is exciting. I want to do this. So after floating there a few times, I was like adamant, I have to be here. And there were a few positions available. I expressed my interest to the night shift manager, and she says, apply, apply. So I did, and was hired. And like I said, I was still fairly new to nursing and in my career, and became a neonatal nurse. And that was exciting to me. And throughout my first few years of nursing, I learned quite a bit. I worked in level threes and level fours throughout my beginning, and became a transport nurse, and just really honed in on those skills. And from there, I became a pediatric ICU nurse, decided that's kind of what I wanted to add. And being a neonatal nurse and a pediatric ICU nurse, um, you kind of have to experience that acute care side of pediatrics.
Yeah.
And so I did take that time to become what we call the acute care nurse, working in a medical center, and had time to work outside of the medical center in pediatric services as well, home care, and clinic, um, what we call urgent care as well. So I've had the experience from outpatient to inpatient, time with our pediatric population.
Yeah.
So it really is something that I'm kind of ground in, and I can do adults, but it's truly not something that I like to put out there. Oh yeah, I'm an adult nurse. No, because then they expect you to do it. So, you know,
Now,
you have
yeah.
family and friends that come to you and say, well, I had this problem. I'm a peds nurse.
I usually say call the doctor. I'm like,
Yeah,
I don't know. Call
exactly.
the doctor.
Yeah,
I'm not responsible for any diagnoses. Call your doctor.
right.
But it happens. Now I mean you found your path, I would say early on, right? I mean a year of adult acute care, and then you said, you know what, I think I enjoyed this other pathway. And from our previous conversations, I know you stayed in that realm for quite some time before you said, I want to go back to school and things like that. Now I know a lot of our nurse colleagues say at the bedside and like they stay honed in into that area for somebody who's I didn't go that route, but for somebody who is a bedside nurse, right? um what is the best way to professionally develop yourself? Because, some people say, I'm not going to go back to school. I'm done with school. And I have friends like that, and they're amazing nurses, but they just don't want to go back to school. It's not the pathway for everybody. For somebody who spent a few years fine-tuning your craft, what is your opinion or what is your recommendation for somebody who's going to be a bedside nurse for their entire career? How do they continue to professionally develop themselves where they are really honing in their skill set other than their day to day, right? The day to day, obviously you're going to get good at that, but I feel like your skills and your education becomes stagnant after a while. How do you recommend somebody like that to stay fresh and engaged and really like fine tune their craft? How do they do that?
Well, I can tell you what I did, uh,
That works.
especially 31 years at the bedside with an associate's degree. Um, I felt I had a larger voice in wanting to really provide support to my community.
Yeah.
And so instead of feeling like I'm coming to work, clocking in, clocking out every day, I started working with, the departments of community health within my hospital and really honing in on pediatrics. What can I do to expand my services from what I do at the bedside to assisting in, say, post-discharge care with my community? So
Mm.
when I'm taking care of my patients in the hospital, now I have an idea of what they may experience or what I can do to better prepare them for the transition home. So what does that look like? So working with, the community health partners there in the hospital, because there's usually a department of community health because they work out into the community. They partner with other either county or city agencies to assist the community. And so I started working with those departments to expand some of the knowledge that I had uh, or that I could then parlay from the unit to outside the hospital. And that's
Mm.
what got me interested in doing community health um, and working in the clinics and urgent care. Because sometimes if you are able to provide some type of support in those community settings, it will alleviate the need to be hospitalized
Yeah.
and show up in the ED, and you have sick pediatric patients who come in with, say, asthma, the I can't say the word, but
E- All right.
when they're,
Exacerbation?
thank you. Yeah,
That's what I'm here for. Support.
right. So they're admitted to the ED, and then they end up in the pediatric ward or PICU. However, if you're in the urgent care or a clinic, you can actually work with the families on determining as a child is going through their day-to-day operations, what kind of triggers do you see to assist them in being able to work on some of that difficulty they have when it comes
Mm.
to respiratory distress prior to them getting so bad that they have to seek medical attention in the ED. So working with the families along with, even type 1 diabetes, working with them in the community so the kids understand, the families understand what they should and shouldn't be doing so that they don't fall into requiring that type of higher acuity care in the ED and being transferred into the floor or being admitted into the pediatric unit. So that was something I did to expand some of my skill sets
Yeah.
and really getting involved in more of the administration or inner workings of my particular unit. Being on the shared governance committee, that would allow me to have more say in what we do in the unit and
Yeah.
not just feel like, well, this is all coming down from leadership and now this is what I have to do. And I didn't have any input.
Yeah.
Joining that committee allowed me to be able to see what leadership is wanting to do and understanding the why, and then putting it into words that my colleagues at the bedside could understand,
Yeah.
and really getting my input on what would be most appropriate at the bedside and maybe changing the narrative of what may be most appropriate at the bedside.
Yeah.
That didn't always go over well, but at least I felt like I was part of the process.
Yeah.
Yeah. Yeah.
Now, so you mentioned you were an ADN graduate for 31 years. What was the trigger for you to go back to school?
Actually, working with my leadership team uh in the NICU, pediatric floor, PICU, I began to develop a voice and I felt I wasn't being heard
Mm.
most of the time. And just understanding that if I felt I wanted to create a seat at that table to be heard, I may have to spend the time to go back to school. Because sometimes, and it's not always, because I still have difficulty now, even with a doctorate, being heard. Um, it may give me a chance, a foundation to actually say, well, he does have a degree here, which may mean something, and so maybe we should hear him out.
Mm.
Maybe there is some value in what he is bringing to the table.
Yeah.
So, at 52, I decided, well, this is my time. And I say it's never too late.
Yeah.
I decided I wanted to go back to school and obtain my BSN. And I felt that would be good enough. While I was in my BSN program, it kind of changed my view of what a BSN nurse really was. For ASN nurse for 31, 32 years, I felt I could run circles around a BSN nurse. I mean, I was that good.
I believe it.
However, yeah, however, going back to school and taking those classes that I did not receive as an associate's degree nurse just really broadened my understanding of really what nursing was all about, not just working within the confines of a facility and doing mostly clinical assistance with my patients. Even though now I've worked on the outside of the hospital, working with community health and that type of thing, I still did not have that background of understanding what public health and community health really was.
Right.
Taking those classes, it was like, wow, this is real nursing too, you know? And it
Yeah.
gave me a different appreciation of my counterparts who were bachelor's prepared. So I said, well, if this is what a BSN really is, I need to keep going. And I don't have another 30 years to wait. So while I was in the BSN program, I started looking for a master's program. And I said, let me get a master's, and I think that'll be good. Kept thinking about it, and I said, no, I want to go all. So I found a program which was really phenomenal, and that was really provided by the University of San Francisco. They had a BSN to DNP program, and it was a 4-year program that halfway through the program, you received your MSN, your
Right.
master's, with a clinical, with an academic certification as a clinical nurse leader.
Right.
So that just spoke to me. And I said, this is where I want to go. So I applied and was accepted into the program. And a month after I graduated with my BSN, I started my MSN program and went through another 4 years. So really there was almost 5.5, almost 6 years of education that I went through, working full time, going to school full time,
Wow.
and completed my DNP. So I don't look back on it now as, wow, I shouldn't have done it that way. It was the best decision I could
Yeah.
have ever done for myself. And
That's amazing.
developing that voice that I had early on in my career, and then working the last few years as an ASN, just really was a great foundation for me to say, I need to really build that space for me. And the only way I can do that is to really provide myself more education and understanding of what my career can really bring, uh, to my community, and providing that voice.
Yeah.
And I think I've done that.
Yeah. When you mentioned this, one of the reasons I got my PhD was I was telling my wife at the time, I was like, I never want to be in a situation where I have the skill set or I have the ability, but my degree is going to be my limiting factor. Like I never wanted to be in that position. And if for you, I'm bringing that up because for you, it sounds like you already had your voice and the experience and the degrees just were catching up to you. Not so much you catching up with the degrees,
Correct.
right?
Correct.
So I mean, with somebody with 30 years of experience in the workforce, I mean, they are an expert in what they do.
Yeah.
So it's very interesting that that process is uh, that was ingrained in your like last like the 6 years span that you had in your education. So that's amazing.
Yeah. It's something that I usually provide to, say, the students within my community. Now
Yeah.
I'm uh, on one of the boards here on one of our high achieving schools, public schools here in Stockton. The school is called Health Careers Academy. It
Mm,
is those high school students who have decided they want some type of career in healthcare. And me working in the community, I was asked, would you come and actually speak to our students and provide some support for them, and really kind of talk about your journey? And in doing that, and working with a lot of the juniors and seniors uh, at that high school, the leadership said, you're so energetic, and we want you part of this. Would you please be part of our board and help build some of this our academic programs, and really be part of our journey as an institution? And I was more than happy to lend some of my knowledge, and some of my skill set to moving the school forward. And I enjoy talking to the students and providing them. It's never too late, and anyone can actually do it if you have that passion to want to give back and be part of growth and seeing your community be healthier,
Yeah.
because they have picked that career route. And
Yeah.
I said, as long as you have that passion, and you can do it, you can do it.
Yeah.
I did it, even as an older person,
Yeah.
a seasoned person, I should say.
Season. Now I have a question for you. Now, when you obtained your additional degrees, how did clearly perspective changes? I always tell people, like, if they get their bachelor's, when they get their master's, when they get their doctoral degrees, just their view of the profession changes, right?
Correct.
Like you go from like a 5,000 foot to a 10,000 foot to like a 30,000 foot view, and your perspective changes, your view on your impact changes. Now, clearly that happened for you. How did your work change based on the fact that you became a doctorally prepared registered nurse?
The move from bedside to, say, leadership and being part of, say, the inner workings of a medical center
Yeah,
and pediatric service line uh, really kind of took me, um, the time it took was really the time I was actually in school.
yeah,
But once I received my BSN, I immediately was propelled to an assistant manager. Uh, and while I was in my master's program, I was able then to move into a manager position and was a manager of a pediatric service line for about 4 years. Once I received my doctorate, I was still a manager for a while, but I was kind of feeling myself. Like, I have my doctorate now, and I really believe that if there's not a position for me, I can create one.
yeah,
I came to St. Joseph's here in Stockton as the manager of the neonatal ICU and the pediatric department. They did not have a pediatric service line. However, the medical center was looking ahead, and really the talk that was being had is we kind of want to develop a larger pediatric footprint within the community. They had received um, grants from the state of California and from the federal government um, to build a new pediatric unit, acute care pediatric unit, to go from 10 beds to 18 beds. And they really needed someone to actually hone in on what the service line should look like and how they could then expand the programs here at St. Joseph's to really support the community. And what better person than myself? So, I had those, I began those conversations with my immediate boss, who was the chief nurse officer, and kind of told her, I really think we need to have a pediatric service line here. And I would really like to provide a proposal to senior leadership to actually make this happen.
Yeah.
And she kind of agreed with me and said, we've had some talks already about this. And she says, Blue, I think this could really happen. So within about a month, she says, I've created a new position as a director of a pediatric service line, and I'm encouraging you to apply.
Nice.
So I did. And to give you a timeline, within the first 6 months of my tenure here at St. Joseph's, I was hired in as the first director of a pediatric service line here at St. Joseph.
Wow, amazing.
And so I feel that having this degree as a doctoral prepared nurse really allowed me to go to senior leadership and say, this is my background, this is my education, and I feel I am the best person for this position or to create this position and take us to the next level.
Yeah,
And that was my journey. And, so having more education really allowed me to create that seat because it wasn't there before.
yeah. And I've done it's interesting you say that. So many people I know try to take their degree and try to make themselves fit into something that exists. Like my last three positions, um, or various variations of in the last, I would say 3, 4 years. Like I've approached and I said, you need this skill set within your organization and you need this position, and the position's been created. Uh, Instead of me trying to go into a position that already existed.
Right.
And that, I think that's what like the degree really, it gives you that, it empowers you to say, yes, I have the skill set, but I'm also like doctorally prepared. Like
Exactly.
it's not, yeah. So it's amazing that you had a chief nurse that actually listened. So
Correct.
not all of them listened, but so to have that support system in place, it's really it's sort of an extra kudos to you that she said, yes, you're right, and I want you to apply. That's very cool. Now, I want to talk to you a little bit about, like, besides your work that you do within the hospital, you're very active in the what I would say the profession of nursing outside of your day job, right? You're very active within ACNL, which is the Association of California Nurse Leaders, which we've had um, Dr. Kimberly Long on the show before.
Yeah.
She's the CEO of that organization. And then you're also very active with DNPs of color, which we've also had Dr. Danielle McCamey on the show before. She's amazing. So at what point did you decide I need to get involved in other organizations or get involved in the profession of nursing and have contributions there?
I I guess once I felt comfortable enough here working in my medical center and in the local community, um, again, I felt I had a voice.
Yeah.
In talking to some of my colleagues um, in the organizations that I was a member of, but really never got involved with some of the leadership aspects, um, I kind of got pulled in. You should run for this position or that position. And it's like, yeah, I don't know. Um, but, they were persistent. And I said, okay. And so I ran for my local chapter's uh, board, and then eventually being voted in as one of the officers, and then kind of stayed on the board, and then continually being elected to other offices within the board. So I was initially hired in, or voted in as treasurer to our local chapter of ACNL, which is North Central. Then I became the um, uh, president-elect, and then you go into the presidency, and then now I'm past president, and I still kind of involved with the local chapter. While I was in the local chapter, I was asked to run for the statewide representative from our local region, which is the central San Joaquin Valley region, as a state representative. And so I did that, was voted in. And so now I have that larger footprint in our profession, and I'm able to speak on different aspects of nursing and not just what we do in the hospital. It's, how we provide equity and inclusion, and how we support some of our students who are, in high school and in college, and helping them develop that love for healthcare and nursing specifically. And then just assisting my own colleagues with their understanding of some of the bills and policies and procedures that are out there in our state capital and our U.S. capital, and things that affect nursing and healthcare as a whole.
Yeah, I agree. So I guess the question is, when are you going to run for presidency of ACNL? Or is that in you? Too early to call for that one, or to campaign
Paul, sometimes I
for
feel
now?
I enjoy what I do so much.
Yeah.
Sometimes I feel like I'm spreading myself way too thin.
Wait.
Being active in my local community, and then also being on the board for ACNL, which is our again, a state of California, and now being vice chair of our national organization for DNPs of color,
Yeah.
is quite a bit, and there's a lot of responsibility there. And I think right now, I think being
We're
heard,
good. We're good
yeah,
right now, right?
and
We're
I think I'm good. Yeah.
good. We're good. There's some balance. Some
Yes,
balance.
yes,
Um,
yes,
so so I want to be cognizant of our time.
yes.
So I want to ask you well, two last questions. Um, First one being, if you had because one of the reasons I want to make sure I have you on this was the way you engage. You've always engaged with me. I've always found I always walk away from our conversations like super energized and feeling good about myself. So I want to ask you, what is your secret? What's the secret sauce for you to in I would say networking. Networking, one of my things is like I need to network with people. I go to conferences to network with people. I go to events to network with people. But I feel like it comes almost naturally to you. For me, it's I'm a super introvert. I need to work at it hard. What is your secret sauce for being able to connect with people on such a level that you do? Because I think you have a gift for it.
Wow. Well, that stems back from my childhood. I had a speech impediment as
Mm,
a child, and could not express myself really at all. Um, and so it took me several years, with the assistance of my family and a little bit of therapy that we could afford, to get myself to a place where I could have a decent conversation and somebody understanding what I was saying.
yeah,
And so I really pushed myself to want to engage and have conversation with people, and really put myself in a place where I felt comfortable in them understanding me and them feeling like they could speak to me. And I liked that. I got enthused and excited about that. So now my family is like, you just never shut up. You just keep talking and talking and talking. And so now I have a problem with brevity because I can't stop, you
yeah,
know. Um, so I think it stems from a child not being able to engage, to where now I don't get enough of it. And I want to.
yeah,
And I need to get my ideas across.
yeah,
And if somebody's willing to stop and listen and engage with me, oh, I'm all in.
yeah, yeah. So you're saying the secret is you want to talk to people.
Yeah. Yes.
That's the secret.
Yeah. Yeah.
That's awesome. So again, I want to be cognizant of our time. I've enjoyed, and hopefully we're gonna continue to have conversations
Yeah.
offline, but anything else you want to share with anybody tuning in, listening?
It's never too late to achieve what you feel it's in your heart
Mm.
that you want to be. If you want to be something, you can do it. It's you have to know that this is your path, and knowing this is your path, you need to reach out to those that have been there or that have gone through the journey that you're trying to take, and find those individuals that even look like you, because
Yeah.
they have similar experiences possibly that they can share with you to help you navigate. So some type of mentor that you can really just allow them to know who you really are, that you're comfortable with having deeper conversations with, about your life and what you're experiencing right now. Um, Build that foundation, that way to communicate with others and really want to do what you see yourself doing in the future.
Mm.
And that's what I did. I really wanted to be a nurse. And once I felt I developed a voice, I really wanted to move forward within the profession of nursing to lend my skill set and those things that I felt weren't being done in the community, that I felt I could lend some of my expertise to. Understanding that really propelled me forward. And I think if you really want something, again, bad enough, do it. Just do it.
Beautifully said. So, thank you for that.
Thank you.
Learned a lot. Um, so with that, I'm going to say thank you so much for your time. Thank you to all my listeners for tuning in, and I look forward to bringing you more additional incredible colleagues to the show for us to have a conversation with. So with that said, thank you all very much. Thanks for joining me on the RN Mentor Podcast, a production of RN Mentor Consulting. Please don't forget to follow and check out RNmentor.org for additional content, speakers, podcast notes, and more. Until next time, fair winds and following seas.